In the previous module, we talked about the high levels of pain that many Chiari patients live with and the negative effects that can have on a person's physical, mental, and spiritual health. In this module, we will discuss some of the physical disabilities that are common in Chiari adults, including neck problems, balance issues, and poor sleep, and the impact they can have on daily living, employment, and personal finances. According to the Chiari 1000 database, neck pain is one of the commonly reported symptoms among Chiari adults and is present in 84% of adult women and 74% of adult men. Conquer Chiari explored the impact of this in a study which used a patient-focused questionnaire called the Neck Disability Index, or NDI, and included 474 adult female Chiari patients. The NDI has been used worldwide since the early 1990s to assess neck-related disability and is comprised of 10 questions which ask how a person's neck pain affects their ability to manage everyday activities such as reading, driving, lifting, work, and recreation. The results can be converted into a percentage disability with well-recognized categories of none, mild, moderate, severe, and complete. The Conquer Chiari study found that 80% of the women rated their neck disability at the moderate to complete level. Surprisingly, there was no significant difference in the disability scores between surgical and non-surgical patients. However, patients who experienced symptoms for more than 2 years before diagnosis scored on average 77% higher, meaning worse, on the NDI. In fact, the average NDI score for patients who were diagnosed in less than 2 years was only in the mild category. On the flip side, the study found that patients with severe or complete levels of neck-related disability scored significantly worse on both short-term and long-term memory assessments than patients with none or mild NDI scores. Finally, the study found that patients with EDS, migraines, or scoliosis scored on average 13 to 20% higher on the NDI scale than those without any of those related conditions. In addition to the Conquer Chiari study, other researchers have identified structural and functional issues in Chiari patients that indicate that weakness and instability in the neck are common. For example, one study used MRIs to show that the paraspinal muscles, which are on either side of the spine and are critical in providing support and maintaining posture, are significantly smaller in Chiari patients. Other studies have shown that the suboccipital muscles in the back of the neck are smaller and do not activate properly in Chiari patients. Yet another study found that key stabilizing ligaments in the neck are abnormally short in Chiari patients. And finally, imaging studies have shown that the depressions in the top vertebra, where the skull sits, are unusually shallow in some Chiari patients, allowing for instability between the skull and spine. One aspect of neck-related disability that needs to be explored further is the possible link with migraines. 70% of adult Chiari women and more than half of younger Chiari girls report suffering from migraine headaches. It is recognized among migraine researchers that neck pain is common for migraine sufferers and that there could be a causal link between the two. One small clinical trial found that cervical stabilization training helped to reduce migraine frequency and intensity after only an 8-week program. Next, we will turn our attention to balance. The human balance system is a delicate, complex system which involves several parts. To maintain balance, the body integrates input from 3 sources: the eyes, which provide information about the body's position relative to their environment and detects motion; muscles and joints, which provide information about the body's position relative to itself and the ground, which is known as proprioception; and the inner ear, or vestibular system, which has fluid-filled structures that detect head movements and position. All of this information is sent to the cerebellum, which integrates the information, sends control signals to the muscles, and evaluates and corrects for errors which enable smooth, coordinated movements. Unfortunately, with Chiari, the cerebellum and its connections to the brainstem are compressed and under strain, which disrupts the complicated actions of the balance system. In fact, according to the Chiari 1000, more than 70% of all Chiari patients, adults, kids, males, and females, report balance issues as a significant symptom at the time of diagnosis. Conquer Chiari's physical impact study explored this topic further by using the Activities Balance Confidence Scale 6, which asks people to rate their confidence in performing 6 different balance-related activities. The specific activities are standing on tiptoes reaching for something above your head, standing on a chair reaching for something, being bumped into by people as you walk through the mall, walking onto or off an escalator while holding onto a railing, walking onto or off an escalator while holding onto something such that you cannot hold onto the railing, and walking outside on an icy sidewalk. Each activity is rated from 0 to 100% confident, with the responses averaged for a final confidence score. 62% of the Chiari patients scored 50% or lower, which equates to a low level of physical function and very high risk of falling. In addition to cerebellar issues, loss of ankle stiffness may also play a role in Chiari balance issues. The ankles are an important part of how humans maintain an upright position. When muscles are activated around the ankle during movement, the stability provided is referred to as stiffness. The ankle stability provided when standing still is called quasi-stiffness. One Conquer Chiari study, which used force pressure plates, found that the quasi-stiffness of Chiari subjects was significantly less than that of the controls. The combination of pain, neck weakness, and balance issues results in many Chiari adults disengaging from physical activities. Conquer Chiari's Physical Impact Project showed that an astonishing 84% of patients surveyed scored above the clinical cutoff for kinesiophobia. Kinesiophobia translates literally as fear of movement and is a recognized condition where someone has a debilitating fear of physical movements due to a sense of increased pain or risk of injury. Of course, as someone avoids physical activity and movement, the worse their physical condition can become over time, thus perpetuating the cycle and leading to high levels of depression and anxiety. Given all that is going on physically with Chiari, not surprisingly, patients also have sleep issues. The Physical Impact Project found that 91% of Chiari adults experience poor sleep quality as measured by the Pittsburgh Sleep Quality Index, with the median score falling 2 times above the cutoff for poor sleep. One major contributing factor to this situation is sleep apnea. Research has shown that as many as 60% of Chiari patients, both adults and children, exhibit clinical levels of apnea when evaluated with formal sleep studies. Beyond daytime drowsiness, sleep apnea can have a profound effect on someone's health. During the apnea episodes, it is believed that the heart works harder to compensate for the lack of oxygen, which can lead to high blood pressure and an elevated risk for heart attacks and strokes. In fact, one study found that 50% of people with sleep apnea also had hypertension. Less well known is the link between sleep apnea and eye-related or ocular issues. Research has found a strong association between obstructive sleep apnea and a specific type of optic nerve damage, floppy eyelid syndrome, and glaucoma, among other conditions. For example, people with obstructive sleep apnea are nearly 2.5 times more likely to develop glaucoma than people without apnea. In addition, a 2025 study found a link between obstructive sleep apnea and markers for systemic inflammation. The researchers grouped 263 obstructive apnea patients into 3 groups based on severity: mild, moderate, and severe. When they looked at 4 inflammatory markers, the markers were significantly higher in the severe group than both the moderate and mild groups. The physical disabilities associated with Chiari can have a significant impact on patients' quality of life. A survey of close to 800 patients found that 96% reported that Chiari had a negative impact in at least one area of daily living. Consider the following findings from the Chiari 1000 database. 78% of adults find it somewhat or very difficult to work due to Chiari. 74% report Chiari has had a negative impact on their career, and nearly half have had to change jobs or careers due to Chiari. Of those not working, 80% indicated their employment status was due to Chiari. Approximately 1/3 of Chiari patients seek Social Security disability, with roughly half being successful. Overall, 60% say that Chiari has had a negative impact on their ability to earn money. In terms of schooling, 3/4 of patients say it is difficult to perform academically due to Chiari, and roughly 1/2 of patients who were in school at the time of diagnosis have had to withdraw from school at some point in time. In this module, we reviewed some of the common physical disabilities associated with Chiari, including pain, neck weakness, balance issues, and disrupted sleep. In addition, we explored the profound effects these can have on patients' lives. In the next module, we will look at the cognitive impact of Chiari.